quiet, quiet.
Hi, my name is Joy King, and this is going to be my sterile dressing change. I've gotten all my supplies ready before I go into the room, so that I won't have to turn my back on my patient. I'm going to go into the room, and I'm going to provide privacy with a curtain or a door, whatever's there. I'm going to walk up to my patient. Hi, my name is Joy King, and I'm going to be your student nurse today. Can you please verify your name and date of birth? And now that I've verified with his armband, we gave you medication 30 to 45 minutes ago before we're going to change your wound. How are you feeling? Any pain, any discomfort? And if the patient states no, then I would raise the bed to a working height. And since his wound is on his leg, I don't need to position him, but if repositioning was needed, I would do that. Alright, Mr. Jones, I'm about to start. I have washed my hands, and I'm now about to put on clean gloves. I'm going to prep my biohazard bag by cuffing it. And now I'm going to begin untaping the wound. Move from the outside, pulling in to maintain skin integrity. And at this time, I would note the drainage on the wound pad, the color, any odor at all, and the amount. I'm going to throw this away. And I'm looking at the wound, and I'd note the coloration of the skin, how the skin looks around the wound. I would note any drainage, any odor, and the amount of drainage. And then I'm going to remove my gloves. And I'm going to wash my hands. Now that I've done that, I'm going to prep my sterile field. I have my gloves out. I'm going to prepare my extra 4x4 gauze. At this point, I would pour my sterile fluid over my gauze with my hand against the label. And I would pour slowly to prevent any dripping. Just enough to thoroughly wet my gauze. Now I'm going to put on my sterile gloves. Being careful not to just disrupt the integrity of my sterile field over here. I'm not entirely sure if I disrupted the sterility of my gloves just then, but if I had any doubt at all, I would take an extra pair of gloves and I would redo my sterile glove technique entirely. Alright, now that I've got my sterile gloves on, I am going to begin washing out my wound. One piece of gauze first. From the cleanest to the dirtiest, I would start from the inside in a circular motion. Toss. With a new piece of gauze from the next cleanliest to the dirtiest. And then finally, a third time, I do the dirtiest area. Now that I have a clear view of the wound, I'm going to measure the length, width, and depth of my wound using my sterile measuring paper. Oh. Well, before I do that, I would actually take a clean Q-tip, dip it into my sterile solution, and I would clean any undermining and any tunneling underneath the wound. At that point, I would then throw this away. Measure my wound. Note any undermining and any tunneling using the face of a clock. Do the length, width, and depth of my wound. And since I have not touched the patient with this is still sterile. Okay. Now that I've measured everything, I'm going to take more gauze. I'm going to wring out any extra solution. I'm going to fluff my gauze and prep it for packing the wound. Since I did not actually use the sterile solution, this is going to be harder than it would with actually wet gauze, but I'm going to do my best to maintain the sterility and not touch my patient. I would just take my gauze, pack it into the wound, and like I said, since it's not wet, it's hard to do. And I would pack it into any of the tunneling present on the wound and up underneath the undermining. And then I'm going to throw this away. Now the next thing I'm going to do is I'm going to take one of my 4x4 gauze that I have not used, that's not damp, and place it over my wound. The next step is my abdominal pad. Place it over the wound as well. And at this point, I'm going to remove my sterile gloves. And I'm going to wash my hands. My next step is I'm going to take my 2x2 tape, or 2-inch tape, and starting at the longest edges, I'm going to tape my wound. Preferably without tearing my tape. And then the two shorter sides. Okay. And just to be on the safe side, once again, I'm going to wash my hands. At this point, take out my Sharpie, and I would initial date and time the new dressing. And so my next step is to clean up all of my used supplies. And throw them all away into my biohazard bag. Once again, I'm going to wash my hands if I need to. I'm going to cover up my patient. Raise the side rails if I had lowered it. For this procedure, since I had a wound on the leg, I did not need to lower the head side rail. And I am going to lower my bed to the lowest possible position. If I had repositioned my patient for this procedure, I would put them into a more comfortable position. I would assess my patient's comfort level right now to make sure that everything's okay. Mr. Jones, I'm done with the procedure. Are you okay? Is there any discomfort, or is there anything that you need me to do at the moment? If not, I would gather all of my dirty supplies. And for the biohazard bag, since I cuffed it, I'm going to put my hands up underneath the cuff so I don't touch the interior, which is disgusting. Throw this away. Then I'm going to go document in my EHR, and I'm going to document the type of solution I use, which was normal saline. I'm going to document that I use a wet to dry sterile dressing, and I'm going to document how my patient tolerated the procedure. And at this point, I'm done. I would remove all privacy curtains, throw away all the material that I've taken out of the room, and I'm finished.